In the debate over Biden's COVID package, Republicans and centrist Democrats have argued that it's too big because the economy is already recovering. But you've done the kind of granular reporting at the local level. Do you find the economy recovering? Is that an argument not to help the mass of people, the one they're making?
Well, I think this is important because it goes back to the original sin, if you will, of slavery. And that's that we have remained blind to this country, to the vast portions of our country where the economy is not working. This is a congenital problem. And so you have a situation where even before the pandemic, and this is something Dr. Barber brings out in the interview I had with him, you had 250,000 people dying a year because of inadequate access to health care. That's before the pandemic. And as he points out, you had 7 vaping deaths, and we're convening a White House and congressional conference on it. Meanwhile, 750 are dying a day for lack of health care. That's before the pandemic. So this chronic underinvestment, 3 years of declining life expectancy, now capped by something you can see from space in terms of the decline of life expectancy, is added on to this unraveling that's occurred of the social fabric on a scale that's hard to imagine. Millions of women being pressured out of the workplace, giving back a generation of gains because we had no social safety net. So if someone is sick from COVID, and let's keep in mind that we're talking about 30 million infections, where we're at today, we know at least a third, Rick, who survive will have some chronic healthcare issue of varying severity. Who's going to be caring for those people? But primarily in our society, women. And add the lack of dealing with education means that they're dealing with homeschooling. So all of that stuff that was built up, that infrastructure we had that was weak depending on where you lived, has all but collapsed. And there's been no uniform standing it up. And so as I speak to you now, we have states like Texas and Florida where the governors have decided to flout any basic public health requirements. And if you look at the several states that didn't want to invest in Medicaid when they had a chance, it's exactly like the Confederacy. So we keep seeing this same thing played over and over again. And this Recovery Act is just kind of like the same thing that happened with, and I know this might be blasphemy, but FDR. We like FDR. But the reality is, faced with the political crisis of his time, he wanted to get the Wagner Act through and the Fair Labor Standards that set a minimum wage. And surprise, surprise, they cut out domestic workers and farm workers, leaving a huge chunk of the primarily female and people of color workforce. This has been ongoing